Question 1. Analysis of a situation where a client presents their golden retriever with a rapidly progressing corneal ulcer. The veterinarian has identified several treatment options: aggressive medical management with frequent topical medications and close monitoring, surgical debridement with conjunctival flap, or enucleation. The client expresses significant financial concerns, stating they have a strict budget. The veterinarian must ensure the client fully understands the implications of each choice. Which of the following communication strategies best upholds the principles of informed consent and client autonomy within the DACVO framework? Option A. Providing a written estimate for the most aggressive surgical option and stating that other options are unlikely to be successful, thus avoiding a lengthy discussion about less costly alternatives. Option B. Recommending the least expensive medical management option and focusing the discussion primarily on its potential success, while briefly mentioning surgery as a last resort if medical management fails. Option C. Presenting all treatment options with a clear explanation of the risks, benefits, prognosis, and estimated costs for each, followed by an open discussion to address the client's concerns and facilitate their decision-making process. Option D. Emphasizing the high success rate of surgical intervention and strongly advising the client that it is the only option that will guarantee a positive outcome, regardless of cost. Correct answer is C. Presenting all treatment options with a clear explanation of the risks, benefits, prognosis, and estimated costs for each, followed by an open discussion to address the client's concerns and facilitate their decision-making process. Explanation. This scenario presents a common ethical challenge in veterinary ophthalmology, where the veterinarian must balance the client's financial constraints with the optimal medical outcome for the patient. The core of the dilemma lies in ensuring informed consent, which requires clear, comprehensive communication about all available treatment options, their associated risks, benefits, and costs, without undue influence or coercion. The veterinarian's professional responsibility extends beyond simply presenting choices. It involves facilitating the client's understanding to enable a truly informed decision. The correct approach prioritizes client autonomy and transparency. It involves a detailed discussion of all viable treatment modalities, including their prognoses, potential complications, and financial implications. This ensures the client can make a decision aligned with their values and resources, while also understanding the potential consequences of each choice. This aligns with the ethical principles of veterinary medicine, emphasizing client education and shared decision-making. An incorrect approach would involve downplaying or omitting information about more expensive but potentially more effective treatments, or conversely, pressuring the client towards a specific treatment based on the veterinarian's personal preference or perceived financial limitations of the client. Such actions undermine the principle of informed consent. Failing to fully disclose all options, including their respective risks and benefits, constitutes a breach of ethical duty and potentially regulatory guidelines regarding client communication and informed consent. It can lead to client dissatisfaction, mistrust, and potentially suboptimal patient care if the client is not empowered to make the best choice for their pet given all available information. Professionals should approach such situations by first understanding the client's priorities and financial comfort level, then presenting a full spectrum of medically appropriate options, clearly articulating the pros and cons of each. This should be followed by an open dialogue, allowing the client to ask questions and express concerns, thereby fostering a collaborative decision-making process. Question 2. Investigation of a canine patient presenting with progressive visual impairment, characterized by apparent difficulty navigating in dim light and a subtle, diffuse haziness of the ocular media, prompts a risk assessment regarding the underlying cause of altered light transmission and refraction. Which of the following diagnostic approaches best addresses the potential etiologies and their impact on visual function? Option A. A subjective assessment of the patient's ability to track a moving object in a well-lit room, assuming the haziness is a minor cosmetic issue. Option B. A comprehensive ophthalmic examination focusing on assessing the clarity of the cornea, anterior chamber, lens, and vitreous humor, coupled with a detailed evaluation of pupillary light reflexes and menace response, to identify specific points of light obstruction or deviation. Option C. A trial of topical corticosteroids to address potential underlying inflammation, without further diagnostic investigation into the optical properties of the eye. Option D. Immediate referral for advanced imaging techniques such as computed tomography, CT, or magnetic resonance imaging, MRI, to rule out retrobulbar masses that could be compressing the optic nerve. The correct answer is B. A comprehensive ophthalmic examination focusing on assessing the clarity of the cornea, anterior chamber, lens, and vitreous humor, coupled with a detailed evaluation of pupillary light reflexes and menace response, to identify specific points of light obstruction or deviation. Explanation. This scenario presents a professional challenge due to the inherent complexity of light transmission and refraction within the ocular structures, particularly when assessing potential pathology. A veterinarian must integrate their understanding of optical principles with clinical signs to accurately diagnose and manage ophthalmic conditions. The risk assessment here involves evaluating the potential impact of altered light transmission and refraction on visual function and the underlying ocular health. The correct approach represents best professional practice because it systematically evaluates the patient's visual pathway, considering how changes in the refractive media, cornea, aqueous humor, lens, vitreous humor, and the integrity of light transmission through these structures can manifest as clinical signs. This aligns with the DACVO emphasis on a thorough, evidence-based diagnostic process that prioritizes patient welfare and accurate diagnosis. It reflects a commitment to understanding the fundamental physics of vision as applied to veterinary ophthalmology, ensuring that diagnostic efforts are directed towards identifying the root cause of visual impairment rather than merely treating symptoms. This approach is consistent with the ethical obligations of a veterinary ophthalmologist to provide competent and compassionate care, grounded in scientific knowledge. An incorrect approach that focuses solely on subjective visual assessment without considering the underlying optical principles would be professionally unacceptable. This fails to address the fundamental question of why vision is impaired. It risks misdiagnosis, leading to inappropriate treatment and potentially irreversible vision loss. Such an approach would violate the ethical duty to provide a thorough and accurate diagnosis, potentially falling short of the standards expected by the DACVO. Another incorrect approach that prioritizes immediate surgical intervention without a comprehensive understanding of the refractive and light transmission abnormalities would also be professionally unsound. It bypasses the critical diagnostic steps necessary to confirm the indication for surgery and to anticipate potential complications related to altered optics. It could lead to iatrogenic complications and a failure to achieve the desired visual outcome, contravening the principles of responsible veterinary practice and the ethical imperative to act in the best interest of the patient. The professional decision-making process for similar situations should involve a structured approach. 1. Thorough history-taking and signalment. 2. Comprehensive ophthalmic examination, including assessment of visual function, ocular adnexa, and anterior and posterior segments. 3. Application of knowledge of light transmission and refraction to interpret clinical findings. This includes understanding how changes in corneal clarity, anterior chamber depth, lens opacity, or vitreous opacities affect light pathways. 4. Formulation of differential diagnoses based on the integrated interpretation of clinical signs and optical principles. 5. Selection of appropriate diagnostic tests to confirm or rule out differentials, considering how these tests themselves interact with light and ocular structures. 6. Development of a treatment plan that addresses the underlying cause of the refractive or light transmission abnormality, with a clear understanding of the expected visual outcome. Question 3. What factors determine the adequacy of ocular perfusion in a veterinary patient presenting with suspected optic nerve compromise, considering the need for a comprehensive diagnostic and therapeutic approach? Option A. The patient's age and breed, assuming these are the primary determinants of ocular blood flow. Option B. The veterinarian's personal experience with similar cases and anecdotal reports from colleagues regarding treatment efficacy. Option C. The integration of direct ophthalmic measurements, assessment of systemic cardiovascular parameters, and evaluation of anesthetic depth if applicable. Option D. The subjective impression of conjunctival vascularity and the presence or absence of visible retinal vessels on gross examination. The correct answer is C. The integration of direct ophthalmic measurements, assessment of systemic cardiovascular parameters, and evaluation of anesthetic depth if applicable. Explanation. The scenario presents a challenge in veterinary ophthalmology where a veterinarian must assess the ocular perfusion of a patient, a critical factor influencing treatment outcomes and prognosis, particularly in conditions like glaucoma, optic neuritis, or retinal ischemia. The difficulty lies in translating physiological understanding into practical, evidence-based clinical decisions that align with established veterinary standards of care and ethical obligations, all within the framework of U.S. veterinary regulations. The correct approach emphasizes a comprehensive evaluation of ocular perfusion, integrating multiple diagnostic modalities, and considering the patient's overall health status. This aligns with the principles of responsible veterinary practice, which mandate thorough diagnostics and informed decision-making to ensure patient welfare. Regulatory frameworks, while not dictating specific perfusion measurement techniques, implicitly support such a comprehensive approach by requiring veterinarians to provide a standard of care commensurate with their training and the complexity of the case. Ethical considerations also demand that practitioners utilize the best available knowledge and tools to diagnose and manage ocular conditions effectively. Incorrect approaches fail to meet these standards. Relying solely on subjective assessment without objective data risks misdiagnosis and inappropriate treatment, potentially violating the duty of care owed to the patient. Ignoring systemic factors that influence ocular perfusion, such as cardiovascular health or anesthetic protocols, represents a failure to consider the whole patient, which is a cornerstone of veterinary medicine. Furthermore, making treatment decisions based on anecdotal evidence or personal preference rather than established scientific principles and diagnostic findings is ethically unsound and can lead to suboptimal outcomes, potentially exposing the practitioner to professional review or legal scrutiny. Professional decision-making in such situations requires a systematic approach. 1. Recognize the clinical significance of ocular perfusion for the specific condition. 2. Identify and utilize appropriate diagnostic tools to assess perfusion, e.g., ophthalmoscopy, tonometry, Doppler ultrasonography, fundic examination, assessment of capillary, refill time in conjunctival vessels. 3. Integrate findings from these diagnostics with the patient's signalment, history, and systemic health status. 4. Formulate a treatment plan based on this comprehensive assessment, considering potential risks and benefits, and communicate this plan clearly to the owner. 5. Continuously reevaluate the patient's response to treatment and adjust the plan as necessary. This iterative process ensures that decisions are evidence-based, patient-centered, and ethically defensible. Question 4. When evaluating a middle-aged golden retriever presenting with progressive exophthalmos and chemoses of the left eye, and the owner expresses significant financial concerns and a desire for the quickest, least invasive solution, which of the following diagnostic and therapeutic approaches best balances the animal's welfare with the client's constraints, while adhering to professional ethical standards? Option A. Perform a complete ophthalmic examination, including a thorough assessment of the ocular adnexa and globe position, followed by a discussion with the owner outlining a staged diagnostic plan. This plan would begin with non-invasive imaging such as orbital ultrasonography and potentially advanced imaging like CT or MRI if indicated, to definitively diagnose the cause of exophthalmos and chemoses, before discussing definitive treatment options and their associated risks, benefits, and costs. Option B. Immediately recommend enucleation of the affected eye, citing the owner's financial concerns and the potential for rapid progression of orbital disease, to provide the most definitive and cost-effective solution for the animal's immediate comfort. Option C. Proceed directly to surgical exploration and biopsy of the orbital tissues, as this is the most direct method to obtain a definitive diagnosis and initiate treatment, despite the inherent risks and potential for increased cost if the initial findings are not conclusive. Option D. Prescribe broad-spectrum topical antibiotics and anti-inflammatories, advising the owner to monitor the situation closely and return only if the condition significantly worsens, as further diagnostics may be cost-prohibitive for the owner at this time. Correct answer is A. Perform a complete ophthalmic examination, including a thorough assessment of the ocular adnexa and globe position, followed by a discussion with the owner outlining a staged diagnostic plan. This plan would begin with non-invasive imaging such as orbital ultrasonography and potentially advanced imaging like CT or MRI if indicated, to definitively diagnose the cause of exophthalmos and chemoses, before discussing definitive treatment options and their associated risks, benefits, and costs. Explanation. This scenario presents a professional challenge due to the inherent conflict between the veterinarian's duty to the animal's welfare and the owner's financial constraints and perceived urgency. The veterinarian must navigate these competing interests while adhering to the ethical principles and professional standards expected of a DACVO diplomate, which are implicitly governed by the principles of veterinary medical practice and client communication, as outlined by organizations like the American Veterinary Medical Association, AVMA, and state veterinary practice acts. The core of the challenge lies in providing accurate prognostication and treatment recommendations that are both medically sound and practically achievable for the client, without compromising the animal's well-being or creating a false sense of security. The correct approach represents best professional practice because it prioritizes a thorough diagnostic workup and transparent communication of findings and prognoses. This aligns with the ethical obligation to act in the best interest of the animal patient and to provide clients with the information necessary to make informed decisions. Specifically, it upholds the principle of informed consent by clearly outlining the risks, benefits, and uncertainties associated with different treatment pathways, including the potential for recurrence or progression of the condition. This approach also respects the client's autonomy by presenting options and allowing them to participate in the decision-making process, even when those decisions may not align with the veterinarian's ideal medical recommendation. The emphasis on a staged approach, starting with less invasive diagnostics and escalating as needed, demonstrates responsible resource management and a commitment to avoiding unnecessary procedures. An incorrect approach that involves immediately recommending the most aggressive and expensive surgical intervention without a comprehensive diagnostic evaluation fails to meet the standard of care. This is because it bypasses essential diagnostic steps that could confirm the diagnosis, assess the extent of the disease, and identify any complicating factors. Such an approach could lead to unnecessary surgery, increased financial burden on the owner, and potential complications for the animal if the underlying issue is not fully understood. Ethically, it violates the principle of beneficence by potentially subjecting the animal to risk without adequate justification, and the principle of non-maleficence by not fully exploring less invasive options. It also undermines informed consent by not presenting a complete picture of diagnostic possibilities. Another incorrect approach, which involves deferring definitive treatment and offering only palliative care due to the owner's immediate financial concerns, without a clear diagnostic plan, is also professionally unacceptable. While acknowledging financial limitations is crucial, abandoning a structured diagnostic approach prematurely can lead to a misdiagnosis or delayed treatment of a potentially manageable condition. This could result in the animal suffering unnecessarily or the condition progressing to a point where treatment is no longer feasible or significantly more complex and costly. This approach fails to uphold the veterinarian's primary duty to the animal's welfare by not diligently pursuing a diagnosis and appropriate treatment plan. The professional reasoning process in such situations should begin with a comprehensive history and physical examination, including a detailed ophthalmic assessment. This should be followed by a discussion with the owner about their concerns, expectations, and financial limitations. Based on the initial findings, the veterinarian should then propose a tiered diagnostic plan, explaining the purpose and potential outcomes of each step. This allows for a collaborative approach to decision-making, where the owner can make informed choices about proceeding with diagnostics and treatment based on their understanding of the medical situation and their personal circumstances. Transparency, empathy, and a commitment to the animal's well-being are paramount throughout this process. Question 5. Risk assessment procedures indicate that a 7-year-old Labrador Retriever presents with acute onset of bilateral corneal edema, conjunctival hyperemia, and moderate anterior uveitis. The owner reports no known trauma or systemic illness. Initial ophthalmic examination reveals a deep corneal ulcer in the left eye, with no visible microorganisms on cytology, and a less severe, superficial ulcer in the right eye. Given the limited diagnostic yield from initial cytology and the potential for rapid progression of corneal disease, which of the following approaches best reflects a responsible and ethically sound management strategy within the framework of veterinary ophthalmology? Option A. Advise the owner that without a definitive microbiological diagnosis, treatment is not recommended, and to return if the condition worsens significantly. Option B. Immediately proceed with surgical debridement and conjunctival flap for the left eye's deep ulcer, and initiate topical antibiotic therapy for the right eye, deferring further diagnostics until post-operative recovery. Option C. Recommend immediate enucleation of the left eye due to the deep ulcer and signs of uveitis, and initiate topical antibiotic therapy for the right eye. Option D. Initiate aggressive topical antibiotic, anti-inflammatory, and atropine therapy for both eyes, while concurrently scheduling advanced diagnostics such as corneal culture and sensitivity, and potentially anterior segment optical coherence tomography, ASOCT, to further characterize the corneal pathology and uveitis. The correct answer is D. Initiate aggressive topical antibiotic, anti-inflammatory, and atropine therapy for both eyes, while concurrently scheduling advanced diagnostics such as corneal culture and sensitivity, and potentially anterior segment optical coherence tomography, ASOCT, to further characterize the corneal pathology and uveitis. Explanation. This scenario presents a professional challenge due to the inherent uncertainty in diagnosing and managing complex ocular diseases, particularly when presented with limited diagnostic information and a potentially compromised patient. The veterinarian must balance the urgency of potential vision loss with the need for accurate diagnosis and appropriate treatment, all while adhering to established veterinary ethical and professional standards. The DACVO framework emphasizes evidence-based medicine, client communication, and the responsible use of diagnostic and therapeutic resources. The correct approach represents best professional practice because it prioritizes a systematic diagnostic workup to establish a definitive diagnosis before initiating aggressive or potentially harmful treatment. This aligns with the DACVO commitment to high standards of veterinary ophthalmology, which necessitates accurate diagnosis to guide effective and safe treatment. It also reflects ethical obligations to provide competent care and avoid unnecessary or potentially detrimental interventions. This approach ensures that treatment is tailored to the specific pathology, maximizing the chances of a positive outcome and minimizing the risk of iatrogenic complications. An incorrect approach that involves immediate empirical treatment without a thorough diagnostic evaluation fails to meet professional standards. Such an approach risks masking the underlying disease, leading to delayed or incorrect definitive diagnosis, and potentially exacerbating the condition or causing harm. This is ethically problematic as it deviates from the principle of do no harm and fails to uphold the standard of care expected of a veterinary ophthalmologist. Furthermore, it may represent a failure to adequately inform the client about the diagnostic uncertainties and the rationale for a diagnostic-led approach, potentially leading to misunderstandings and dissatisfaction. Another incorrect approach, such as deferring treatment until a more definitive diagnosis is available, even if the patient is showing signs of progressive vision loss, would be professionally unacceptable. This failure to act in a timely manner when faced with a potentially sight-threatening condition constitutes a breach of the duty of care. While diagnostics are crucial, a veterinarian must also exercise clinical judgment to intervene appropriately when the risk of inaction outweighs the risks of initial, carefully considered therapeutic measures, especially when diagnostic capabilities are limited. This approach neglects the urgency often associated with ocular emergencies and the potential for irreversible damage. The professional decision-making process for similar situations should involve a thorough history and physical examination, followed by a tiered diagnostic approach. This includes considering the most likely differential diagnoses based on the presenting signs and signalment. The veterinarian should then formulate a diagnostic plan that is both comprehensive and practical, taking into account the client's financial constraints and the patient's overall condition. Open and honest communication with the client regarding the diagnostic uncertainties, potential outcomes, and treatment options is paramount. The decision to initiate empirical treatment should be based on a strong suspicion of a specific condition and a clear understanding of the risks and benefits, with a plan for re-evaluation and further diagnostics. Question 6. Cost-benefit analysis shows that while genetic testing for progressive retinal atrophy (PRA) can be a valuable tool, its utility varies significantly by breed and the availability of validated tests. A client presents their young Cavalier King Charles Spaniel with subtle signs suggestive of early retinal dysfunction. The client is highly concerned about the heritable nature of PRA and its potential impact on future breeding plans. Even though they are not currently planning to breed, they are seeking a definitive genetic diagnosis and prognosis. Given the current understanding of PRA genetics and clinical presentation in Cavalier King Charles Spaniels, which of the following approaches best balances diagnostic accuracy, client education, and responsible veterinary practice? Option A. Inform the client that genetic testing is not necessary at this stage, as the clinical signs are subtle. Focus solely on symptomatic treatment for the observed retinal changes, and advise them to revisit the issue if the condition progresses significantly. Option B. Explain that, while genetic testing for PRA is available, the specific mutations causing PRA in Cavalier King Charles Spaniels are not fully elucidated, and current genetic tests may not be definitive for this breed. Advise a thorough ophthalmic examination to assess clinical signs and discuss the typical progressive nature of PRA, outlining management strategies and the limitations of genetic testing in providing a definitive prognosis for this specific breed at this time. Option C. Recommend immediate broad-spectrum genetic testing for all known PRA mutations, explaining that, while some may not be relevant to the breed, a comprehensive screen offers the highest chance of identifying a cause and providing a definitive prognosis for future breeding. Option D. Emphasize the importance of genetic testing for all potential breeding dogs and recommend a specific commercial genetic panel that has shown promise in other breeds, assuring the client that this panel will likely identify the underlying cause and provide a clear prognosis, even if the breed-specific mutations are not yet fully characterized. The correct answer is C. Recommend immediate broad-spectrum genetic testing for all known PRA mutations, explaining that, while some may not be relevant to the breed, a comprehensive screen offers the highest chance of identifying a cause and providing a definitive prognosis for future breeding. Explanation: this scenario is professionally challenging because it requires the veterinarian to balance the owner's desire for a definitive diagnosis and prognosis with the inherent uncertainties of genetic testing and the progressive nature of the disease. The veterinarian must also navigate the ethical considerations of providing information about a heritable condition that could impact future breeding decisions, all within the framework of responsible veterinary practice and client communication. The correct approach represents best professional practice because it prioritizes accurate, evidence-based information delivery and shared decision-making. By explaining the current limitations of genetic testing for PRA in this specific breed, discussing the typical clinical progression, and outlining diagnostic options, the veterinarian empowers the owner with realistic expectations and allows them to make informed choices about their pet's care. This aligns with the ethical principles of client autonomy and beneficence, ensuring the owner understands the condition and the available management strategies. An incorrect approach that focuses solely on immediate genetic testing without acknowledging breed-specific limitations or the progressive nature of PRA fails to provide a complete picture. This could lead to misinterpretation of results, unnecessary financial burden for the owner, and potentially delayed or inappropriate management strategies. Ethically, this approach could be seen as misleading by omission, as it doesn't fully address the complexities of PRA diagnosis and prognosis. Another incorrect approach that dismisses the owner's concerns about genetics and focuses only on symptomatic treatment overlooks the significant impact of heritable diseases on animal welfare and responsible breeding practices. Ethically, this demonstrates a lack of empathy and a failure to address a crucial aspect of the owner's inquiry, potentially leading to a breakdown in the veterinarian-client relationship. A further incorrect approach that overpromises definitive genetic answers without acknowledging the current scientific limitations for the breed is professionally irresponsible. This could lead to false reassurance for the owner and a failure to prepare them for the potential progression of the disease, violating the principle of honesty and transparency. The professional decision-making process for similar situations should involve a thorough understanding of the specific condition, PRA, its genetic basis and known mutations in different breeds, and the current diagnostic capabilities. It requires clear, empathetic communication with the owner, active listening to their concerns, and a collaborative approach to developing a diagnostic and management plan that is tailored to the individual patient and owner's circumstances. This involves managing expectations, explaining uncertainties, and providing evidence-based recommendations. Question 7. Benchmark analysis indicates that a veterinary ophthalmologist has performed advanced diagnostic imaging, specifically computed tomography, CT, of the orbits and globe, on a canine patient presenting with exophthalmos and suspected retrobulbar mass. The CT reveals an ill-defined, heterogeneous soft tissue opacity within the retrobulbar space, which is suggestive of a mass, but also has characteristics that could be consistent with severe inflammation or granulomatous disease. The owner is anxious for a definitive diagnosis and treatment plan. Which of the following approaches best represents professional and ethical practice in communicating these findings to the owner? Option A. Describe the opacity as a possible tumor and suggest starting empirical anti-inflammatory treatment while awaiting further diagnostic information. Option B. Explain that the CT shows an ill-defined retrobulbar opacity that is highly suggestive of a mass, but also acknowledge that severe inflammation or granulomatous disease can present similarly, and recommend fine needle aspirate cytology or biopsy for definitive diagnosis. Option C. State that the CT scan was inconclusive and recommend repeating the imaging in 3 months to monitor for changes. Option D. Present the imaging findings as definitively indicating a retrobulbar tumor, recommending immediate surgical excision and biopsy. Correct answer is D. Present the imaging findings as definitively indicating a retrobulbar tumor, recommending immediate surgical excision and biopsy. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent uncertainty in interpreting advanced diagnostic imaging findings, particularly when they are subtle or atypical. The veterinarian must balance the desire to provide the most comprehensive diagnostic information with the ethical obligation to avoid overpromising or misrepresenting the diagnostic capabilities of the imaging modality. The potential for misinterpretation, leading to unnecessary further diagnostics or inappropriate treatment, necessitates a cautious and transparent approach. Correct approach analysis. The correct approach prioritizes clear, honest, and evidence-based communication with the owner. It acknowledges the limitations of the imaging modality while highlighting its diagnostic utility. Specifically, it involves presenting findings in a way that reflects the level of certainty, discussing differential diagnoses supported by the imaging, and clearly outlining the next steps for definitive diagnosis or treatment. This aligns with the ethical principles of informed consent and client autonomy, ensuring the owner can make decisions based on accurate information. Furthermore, it upholds the professional standard of care by not presenting speculative findings as definitive diagnoses. Incorrect approaches analysis. One incorrect approach involves presenting the imaging findings as definitive, without acknowledging any ambiguity or the need for further confirmation. This is ethically problematic as it misrepresents the diagnostic certainty and can lead to the owner making treatment decisions based on potentially inaccurate information. It violates the principle of honesty and can result in financial and emotional distress for the client if subsequent diagnostics or treatments prove unnecessary or ineffective. Another incorrect approach is to dismiss the imaging findings as inconclusive without thoroughly exploring their potential diagnostic significance or suggesting appropriate follow-up. This could be considered a failure to provide adequate veterinary care, especially if the imaging was performed with the expectation of yielding diagnostic information. It may also fall short of the professional standard of care if a reasonable veterinarian would have pursued further interpretation or investigation of the observed abnormalities. A third incorrect approach is to suggest highly speculative or improbable diagnoses based on minimal or ambiguous imaging evidence, without clearly delineating these as possibilities rather than probabilities. This can mislead the owner, create unrealistic expectations, and potentially lead to unnecessary and costly diagnostic or therapeutic interventions. It demonstrates a lack of professional restraint and an over-reliance on speculative interpretation. Professional reasoning. Professionals should approach advanced diagnostic imaging interpretation with a framework that emphasizes critical evaluation, transparency, and client-centered communication. This involves 1. Thoroughly reviewing all available imaging data, considering the clinical history and physical examination findings. 2. Interpreting findings within the context of known disease processes and the limitations of the imaging modality. 3. Clearly articulating the level of diagnostic certainty for each finding, using appropriate terminology. 4. Discussing differential diagnoses supported by the imaging, ranking them by likelihood where possible. 5. Outlining recommended next steps for definitive diagnosis or management, including alternative diagnostic options and their respective benefits and risks. 6. Ensuring the client fully understands the information presented and has the opportunity to ask questions before making decisions. Question 8. Strategic planning requires a comprehensive approach to diagnosing and managing ocular surface disease. When presented with a canine patient exhibiting corneal ulceration and significant stromal infiltrate, which diagnostic strategy best ensures targeted and effective therapeutic intervention for potential infectious or non-infectious keratitis? Option A. Perform corneal cytology and obtain samples for bacterial and fungal culture and sensitivity testing prior to initiating definitive antimicrobial or anti-inflammatory therapy. Option B. Rely solely on clinical signs and empirical treatment with a combination of topical antimicrobials and anti-inflammatories, deferring diagnostic testing unless complications arise. Option C. Administer systemic antibiotics and anti-inflammatory medications, and monitor the corneal lesion for resolution without specific diagnostic sampling. Option D. Initiate broad-spectrum topical antimicrobial therapy and topical corticosteroids immediately, with a plan to perform diagnostics if the condition does not rapidly improve. The correct answer is A. Perform corneal cytology and obtain samples for bacterial and fungal culture and sensitivity testing prior to initiating definitive antimicrobial or anti-inflammatory therapy. Explanation. Scenario analysis. This scenario presents a common yet challenging diagnostic dilemma in veterinary ophthalmology. Differentiating between infectious and non-infectious causes of keratitis is critical for effective treatment and preventing vision loss. The challenge lies in the overlapping clinical signs, the need for accurate diagnostic testing, and the potential for rapid progression of disease. Misdiagnosis can lead to inappropriate therapy, delayed resolution, increased patient suffering, and potential for irreversible damage, all of which have implications for professional responsibility and client trust. Correct approach analysis. The correct approach emphasizes a systematic diagnostic process that prioritizes definitive identification of the underlying cause. This aligns with the DACVO commitment to evidence-based medicine and the highest standards of patient care. By performing cytology and culture/sensitivity testing, the veterinarian is actively seeking objective data to differentiate between bacterial, fungal, viral, or parasitic etiologies versus sterile inflammatory processes. This methodical approach ensures that treatment is targeted, maximizing efficacy and minimizing the risk of antibiotic resistance or exacerbating non-infectious inflammation with inappropriate medications. This reflects the ethical obligation to provide competent and diligent care, as expected of a diplomate-level practitioner. Incorrect approaches analysis. An approach that relies solely on empirical treatment without diagnostic confirmation fails to meet the standard of care. This is because it bypasses the crucial step of identifying the specific pathogen or inflammatory trigger. If the keratitis is infectious, empirical treatment might be ineffective, allowing the infection to worsen. If it is non-infectious, the use of broad-spectrum antimicrobials can contribute to the development of antimicrobial resistance, a significant public health concern, and may mask or even worsen the underlying inflammatory condition. This approach demonstrates a lack of thoroughness and a failure to utilize available diagnostic tools, which is contrary to the principles of responsible veterinary practice. Another incorrect approach involves delaying diagnostic testing in favor of immediate, aggressive treatment based on presumptive diagnosis. While prompt treatment is often necessary, delaying definitive diagnostics can lead to a prolonged period of ineffective therapy if the initial assumption is incorrect. This can result in increased patient morbidity and a higher likelihood of complications. Furthermore, it may lead to the unnecessary use of potent medications, such as corticosteroids, in the presence of an undiagnosed infection, which can have devastating consequences. This approach prioritizes speed over accuracy, potentially compromising patient outcomes and professional judgment. Professional reasoning. When faced with keratitis, the professional decision-making process should involve a tiered approach. First, a thorough history and comprehensive ophthalmic examination are essential to gather initial clues. Second, based on clinical findings, a differential diagnosis list should be generated, encompassing both infectious and non-infectious causes. Third, diagnostic tests should be selected to systematically rule in or rule out these differentials. Cytology is invaluable for identifying inflammatory cells and potential microorganisms. Culture and sensitivity testing are paramount for identifying specific bacterial or fungal pathogens and guiding antimicrobial selection. For suspected viral or parasitic causes, specific diagnostic assays may be warranted. Finally, treatment should be initiated based on definitive or highly probable diagnoses, with a plan for re-evaluation and adjustment of therapy based on the patient's response and diagnostic results. This systematic, evidence-based approach ensures optimal patient care and upholds professional integrity. Question 9. The efficiency study reveals that the new optical coherence tomography (OCT) unit in your practice has a high utilization rate, leading to increased revenue. A client presents their dog with a history of gradual vision loss, and upon initial examination, you suspect a retinal degeneration. The client, having heard about OCT from a friend, specifically requests an OCT scan, believing it will definitively diagnose their pet's condition and guide treatment. While OCT can provide detailed cross-sectional images of the retina, its diagnostic yield for certain types of retinal degeneration can be limited without correlating clinical signs and other diagnostic tests. You are aware that a comprehensive ophthalmic examination, including fundic examination, electroretinography, ERG, and potentially genetic testing, might be more informative for this specific suspected condition. Which of the following represents the most ethically and professionally sound approach? Option A. Recommend the OCT scan immediately, highlighting its advanced capabilities and potential to reveal subtle changes, without detailing its limitations or alternative diagnostic options. Option B. Politely decline the OCT scan, stating that it is not indicated for this case, without providing further explanation or alternative diagnostic suggestions. Option C. Perform the OCT scan as requested by the client, explaining that while it may not be the sole diagnostic tool, it can provide additional information. Option D. Explain to the client that based on the initial clinical findings, a comprehensive ophthalmic examination, including fundic examination and ERG, is the recommended diagnostic pathway, and discuss the limitations of OCT for their pet's specific suspected condition. The correct answer is C. Perform the OCT scan as requested by the client, explaining that while it may not be the sole diagnostic tool, it can provide additional information. Explanation. This scenario presents a professional challenge rooted in the ethical obligation to provide accurate and unbiased information to clients, balanced against the potential for financial gain. The veterinarian must navigate the conflict between their professional judgment, the client's perceived needs, and the financial implications of recommending a particular diagnostic tool. The DACVO framework emphasizes evidence-based practice and client welfare as paramount. The correct approach represents best professional practice because it prioritizes client education and informed consent by explaining the limitations of the OCT in the context of the specific clinical presentation and offering alternative diagnostic pathways that are more appropriate for the initial assessment. The veterinarian upholds their ethical duty to act in the best interest of the animal patient. This approach aligns with the principles of veterinary ethics, which mandate honesty, competence, and prioritizing patient well-being over financial considerations. Transparency about the diagnostic capabilities and limitations of technology is crucial for building client trust and ensuring appropriate care. An incorrect approach that involves recommending the OCT solely based on its availability or a desire to utilize new technology, without a clear clinical indication or a thorough explanation of its limitations relative to the presenting problem, would be professionally unacceptable. This could lead to unnecessary client expense, delayed diagnosis of the actual condition, and potential erosion of client trust. Ethically, it violates the principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, including financial harm to the client. It also fails to uphold the standard of care by not recommending the most appropriate diagnostic steps. Another incorrect approach would be to dismiss the client's request for OCT without a clear, reasoned explanation, potentially appearing dismissive or unknowledgeable. While not recommending an inappropriate test is correct, failing to adequately communicate the rationale behind that decision can lead to client dissatisfaction and a perception of poor service. This can indirectly harm the client-practitioner relationship and potentially lead to the client seeking care elsewhere without proper understanding. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's clinical signs, a thorough understanding of the diagnostic capabilities and limitations of available technologies, and open communication with the client. The veterinarian should first determine the most appropriate diagnostic steps based on the presenting problem and established veterinary ophthalmology principles. If a technology like OCT is being considered, its specific utility for the suspected condition must be clearly established. The veterinarian should then communicate this information to the client, explaining the rationale for recommended diagnostics, potential benefits, limitations, and associated costs, allowing the client to make an informed decision. Question 10. Strategic planning requires a comprehensive understanding of the potential etiologies and management pathways for retinal detachment in canine patients. Considering a case of sudden onset retinal detachment in a middle-aged Labrador retriever with no prior ocular history, which of the following diagnostic and therapeutic approaches best aligns with current DACVO guidelines for optimal patient care and prognosis? Option A. Initiate broad-spectrum anti-inflammatory and antihypertensive medications, as these are common supportive therapies for retinal detachment. Option B. Perform a thorough ophthalmic examination including fundic evaluation, ocular ultrasonography, and potentially electroretinography to determine the underlying cause and extent of detachment before formulating a treatment plan. Option C. Immediately proceed with retinal reattachment surgery, as this is the most definitive treatment for retinal detachment. Option D. Recommend euthanasia due to the poor prognosis typically associated with sudden onset retinal detachment in dogs. The correct answer is C. Immediately proceed with retinal reattachment surgery, as this is the most definitive treatment for retinal detachment. Explanation. This scenario presents a professionally challenging situation due to the inherent complexity of retinal detachment in veterinary ophthalmology, requiring a nuanced understanding of multiple etiologies and management strategies. The challenge lies in differentiating between primary and secondary causes, assessing the stage and severity of detachment, and selecting the most appropriate therapeutic intervention, which may range from medical management to complex surgical procedures. Furthermore, the veterinarian must consider the patient's overall health, owner's financial and emotional capacity, and the potential for vision restoration versus preservation of ocular comfort. Careful judgment is paramount to avoid unnecessary interventions, manage owner expectations, and achieve the best possible outcome for the animal. The correct approach represents best professional practice by prioritizing a thorough diagnostic workup to identify the underlying cause of retinal detachment. This aligns with the ethical obligation to provide competent and evidence-based veterinary care, as mandated by the American College of Veterinary Ophthalmologists, DACVO standards of practice, which emphasize accurate diagnosis as the foundation for effective treatment. A systematic approach, including ophthalmic examination, fundic evaluation, and potentially advanced imaging like ultrasonography or electroretinography, allows for targeted treatment. For example, if the detachment is secondary to uveitis, addressing the inflammation is the primary therapeutic goal. If it's due to a degenerative process, management might focus on slowing progression or managing secondary complications. This diagnostic-driven approach minimizes the risk of inappropriate or ineffective treatments, thereby maximizing the chances of vision preservation or improving ocular comfort, and upholding the veterinarian's duty of care. An incorrect approach that involves immediate surgical intervention without a comprehensive diagnostic evaluation is professionally unacceptable. This fails to meet the standard of care by potentially performing an invasive procedure for a condition that might be medically manageable or for which surgery has a poor prognosis due to an unaddressed underlying cause. This could be considered a violation of the principle of do no harm and may constitute professional negligence. Another incorrect approach, such as solely relying on supportive medical therapy without further investigation when surgical intervention might offer a better prognosis, also falls short. This could be seen as a failure to offer the full spectrum of available, evidence-based treatment options, potentially limiting the patient's chances of vision recovery and not fully meeting the owner's expectations for optimal care. Both scenarios demonstrate a lack of thoroughness and a deviation from the systematic diagnostic and therapeutic process expected of a veterinary ophthalmologist. The professional decision-making process for similar situations should involve a structured approach. 1. Comprehensive history and physical examination. 2. Thorough ophthalmic examination including detailed fundic evaluation. 3. Diagnostic imaging, e.g., ocular ultrasound, OCT-ERG, as indicated to elucidate the cause and extent of detachment. 4. Differential diagnosis generation based on findings. 5. Discussion with the owner regarding diagnostic and therapeutic options, including prognosis, risks, benefits, and costs. 6. Implementation of the chosen diagnostic and therapeutic plan, with regular reevaluation and adjustment as needed. This systematic process ensures that decisions are informed, ethical, and patient-centered, adhering to the highest standards of veterinary ophthalmological practice. Question 11. Market research demonstrates a growing concern among pet owners regarding the potential for vision impairment in their animals. A 7-year-old Labrador retriever presents with sudden onset of bilateral retinal hemorrhages, without any history of trauma. The owner is anxious about the prognosis and asks for immediate treatment to restore vision. Considering the potential etiologies and the need for a definitive diagnosis, which of the following diagnostic and management strategies best aligns with established veterinary ophthalmology principles and regulatory expectations for patient care? Option A. Perform a comprehensive ophthalmic examination, including fundic evaluation, and recommend systemic diagnostics such as blood pressure measurement and a complete blood count to investigate potential underlying causes like hypertension or coagulopathy. Option B. Focus solely on topical ophthalmic treatments to reduce intraocular inflammation, assuming the hemorrhage is an isolated ocular event unrelated to systemic health. Option C. Immediately administer a broad-spectrum anti-inflammatory medication and advise the owner that vision loss is likely irreversible without further diagnostic investigation. Option D. Advise the owner that retinal hemorrhages are common in older dogs and often resolve spontaneously, suggesting a wait-and-see approach without any immediate diagnostic workup. The correct answer is A. Perform a comprehensive ophthalmic examination, including fundic evaluation, and recommend systemic diagnostics such as blood pressure measurement and a complete blood count to investigate potential underlying causes like hypertension or coagulopathy. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misdiagnosis and inappropriate treatment of retinal hemorrhage in a veterinary patient. The complexity arises from the diverse etiologies of retinal hemorrhage, ranging from systemic diseases to local ocular trauma, each requiring a distinct diagnostic and therapeutic approach. Failure to accurately identify the underlying cause can lead to delayed or ineffective treatment, potentially resulting in irreversible vision loss or systemic complications for the animal. The veterinarian must integrate clinical signs, diagnostic findings, and an understanding of differential diagnoses within the established veterinary ethical and regulatory framework. Correct approach analysis. The correct approach involves a systematic diagnostic workup to identify the underlying cause of the retinal hemorrhage. This aligns with best professional practice as mandated by the American College of Veterinary Ophthalmologists, DACVO, guidelines, which emphasize evidence-based medicine and a thorough differential diagnosis process. Specifically, this approach necessitates a comprehensive ophthalmic examination, including fundic examination and consideration of systemic diagnostics, e.g., blood work, blood pressure measurement, if indicated by the clinical presentation. This methodical investigation ensures that treatment is targeted to the root cause, maximizing the chances of a positive outcome and adhering to the veterinarian's duty of care. Incorrect approaches analysis. One incorrect approach would be to immediately initiate treatment for a presumed cause without a thorough diagnostic investigation. This represents a failure to adhere to the principles of responsible veterinary practice, which requires a definitive diagnosis before initiating treatment. Such an approach could lead to administering inappropriate medications, masking underlying systemic diseases, and potentially exacerbating the condition, thereby violating the veterinarian's ethical obligation to act in the best interest of the animal. Another incorrect approach would be to dismiss the retinal hemorrhage as a minor finding without further investigation, especially if the animal appears otherwise stable. This overlooks the potential for serious underlying systemic or ocular pathology. The DACVO emphasizes the importance of a complete ophthalmic evaluation for any significant ocular finding. Failing to investigate could constitute negligence and a breach of professional standards, potentially leading to adverse outcomes for the patient and professional repercussions. A third incorrect approach would be to rely solely on anecdotal evidence or non-validated diagnostic methods. Veterinary medicine, as governed by regulatory bodies and professional colleges like the DACVO, is grounded in scientific evidence and validated diagnostic techniques. The use of unproven methods or anecdotal recommendations deviates from established standards of care and can lead to misdiagnosis and ineffective treatment, compromising patient welfare and professional integrity. Professional reasoning. Professionals should approach cases of retinal hemorrhage by first performing a thorough ophthalmic examination to characterize the hemorrhage location, extent, associated findings. This should be followed by a systematic consideration of differential diagnoses, which may include hypertension, coagulopathies, infectious diseases, inflammatory conditions, neoplasia, and trauma. The decision to pursue systemic diagnostics should be guided by the ophthalmic findings and the patient's overall clinical status. This structured approach ensures that all potential causes are considered and addressed appropriately, upholding the highest standards of veterinary care and professional conduct. Question 12. The evaluation methodology shows a canine patient presenting with sudden onset of unilateral vision loss, mydriasis, and a pale optic nerve head. The differential diagnosis list includes optic neuritis, glaucoma, and vascular compromise. Given the clinical signs suggestive of reduced ocular perfusion, which diagnostic strategy best addresses the potential for compromised ocular blood supply and guides appropriate management within the scope of advanced veterinary ophthalmology? Option A. Administer systemic corticosteroids and broad-spectrum antibiotics, and schedule a follow-up examination in 1 week to assess for improvement. Option B. Recommend immediate enucleation due to the severity of vision loss and the pale optic nerve head. Without further diagnostic investigation, Option C. Proceed with a comprehensive diagnostic workup including Doppler ultrasonography of the orbital vasculature, fluorescein angiography to assess retinal and optic nerve perfusion, and consider a trial of intraocular pressure-lowering medication. Option D. Perform a complete ophthalmic examination, including tonometry, fundic examination, and electroretinography and initiate empirical treatment for optic neuritis. The correct answer is D. Perform a complete ophthalmic examination, including tonometry, fundic examination, and electroretinography and initiate empirical treatment for optic neuritis. Explanation. The evaluation methodology shows a scenario where a veterinary ophthalmologist is presented with a complex case involving suspected ocular ischemia. This is professionally challenging because accurate diagnosis and appropriate management of compromised ocular blood supply are critical for preserving vision and preventing irreversible damage. The nuances of ocular vascular anatomy and physiology, coupled with the potential for rapid deterioration, demand a high level of diagnostic acumen and therapeutic precision. Misinterpretation of findings or delayed intervention can lead to permanent vision loss, significantly impacting the animal's quality of life and raising ethical concerns regarding the standard of care. The correct approach represents best professional practice by prioritizing a comprehensive, evidence-based diagnostic workup that directly addresses the suspected vascular compromise. This involves utilizing advanced imaging modalities and diagnostic tests that are specifically designed to assess ocular blood flow, such as Doppler ultrasonography, fluorescein angiography, or optical coherence tomography angiography, OCT, when indicated and available. Such an approach aligns with the DACVO commitment to advancing veterinary ophthalmology through rigorous scientific inquiry and the application of the most effective diagnostic tools. Adherence to established diagnostic protocols and a thorough understanding of the pathophysiology of ocular vascular diseases are paramount. This ensures that treatment decisions are based on objective findings, maximizing the chances of a favorable outcome and upholding the veterinarian's duty of care to the patient. An incorrect approach would involve making a presumptive diagnosis based solely on gross ocular appearance, without further investigation into the underlying vascular status. This is professionally unacceptable as it bypasses essential diagnostic steps, potentially leading to misdiagnosis and inappropriate treatment. Ethically, It fails to meet the standard of care expected of a veterinary ophthalmologist, as it does not adequately explore the etiology of the clinical signs. Another incorrect approach would be to initiate empirical treatment for a condition that mimics vascular compromise without confirming the vascular deficit. This is a failure of professional reasoning, as it risks treating the wrong condition, delaying appropriate care for the actual cause, and potentially causing harm through unnecessary or ineffective interventions. Furthermore, failing to consult relevant literature or seek expert opinion when faced with diagnostic uncertainty regarding ocular blood supply represents a lapse in professional development and a deviation from best practices in evidence-based medicine. The professional reasoning process for similar situations should involve a systematic approach. 1. Thorough history and physical examination, including a detailed ophthalmic assessment. 2. Formulation of a differential diagnosis list, with particular attention to conditions affecting ocular blood supply. 3. Prioritization of diagnostic tests based on the likelihood of each differential and the potential impact on prognosis and treatment. 4. Interpretation of diagnostic findings in the context of the patient's clinical presentation and known pathophysiology. 5. Development of a treatment plan based on confirmed or highly suspected diagnoses, with clear communication of prognosis and potential risks to the owner. 6. Ongoing monitoring and reevaluation of the patient's response to treatment. Question 13. The assessment process reveals a canine patient presenting with bilateral ocular discharge, conjunctival hyperemia, and mild chemoses. The owner reports the onset was gradual over the past 48 hours. The veterinarian is considering initial therapeutic interventions. Which of the following diagnostic and therapeutic approaches best aligns with established veterinary ophthalmology principles for this presentation? Option A. Immediately refer the patient to a board-certified veterinary ophthalmologist without performing any initial diagnostic steps, citing the bilateral nature of the signs. Option B. Administer topical broad-spectrum antibiotic and corticosteroid eye drops to address presumed infection and inflammation, and schedule a recheck in 1 week. Option C. Perform a thorough ophthalmic examination including visual acuity assessment, menace response, pupillary light reflexes, palpation of the globe, and fluorescein staining to assess corneal integrity before initiating any treatment. Option D. Prescribe oral non-steroidal anti-inflammatory drugs, NSAID, and recommend warm compresses for the eyelids, assuming a primary allergic or irritant etiology. The correct answer is B. Administer topical broad-spectrum antibiotic and corticosteroid eye drops to address presumed infection and inflammation, and schedule a recheck in 1 week. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary ophthalmology, differentiating between primary inflammatory conditions of the eyelid and conjunctiva and secondary complications arising from them. The presence of discharge, chemoses, and conjunctival hyperemia can be indicative of a range of etiologies, from simple allergic conjunctivitis to more serious conditions like corneal ulceration or even systemic disease. The professional challenge lies in accurately diagnosing the underlying cause to implement appropriate and effective treatment, avoiding unnecessary interventions or delays in critical care. Misdiagnosis can lead to prolonged suffering for the animal, increased financial burden for the owner, and potential for irreversible vision loss. Correct approach analysis. The correct approach involves a systematic and thorough ophthalmic examination, prioritizing diagnostic steps that directly address the observed signs and potential underlying causes. This includes a detailed history, visual acuity assessment, menace response, pupillary light reflexes, and palpation of the globe. Crucially, it necessitates a complete ocular surface examination using magnification and appropriate lighting, including fluorescein staining, to assess for corneal integrity. This methodical approach aligns with the principles of responsible veterinary practice and the ethical obligations to provide competent care. By systematically ruling out or confirming corneal involvement, the veterinarian can then accurately differentiate between primary ocular surface disease and other potential issues, guiding treatment towards the most probable diagnosis. This adherence to diagnostic principles ensures that treatment is targeted and effective, minimizing patient risk and owner concern. Incorrect approaches analysis. Initiating broad-spectrum antibiotic and anti-inflammatory therapy without first confirming the absence of corneal ulceration is a significant regulatory and ethical failure. This approach bypasses essential diagnostic steps, potentially masking a corneal lesion or leading to the use of inappropriate medications. For instance, topical corticosteroids, while effective for inflammation, can exacerbate corneal ulceration and delay healing, leading to descemetosal or even perforation. This constitutes a failure to exercise due diligence and provide competent care, violating the implicit contract of trust between the veterinarian and the animal owner. Furthermore, it deviates from established diagnostic protocols for ocular surface disease, which are foundational to veterinary ophthalmology. Another incorrect approach is to solely focus on topical treatments for conjunctivitis, without considering the possibility of deeper ocular or systemic involvement. While conjunctivitis is a common presentation, it can be a symptom of more serious underlying conditions. Failing to investigate further, such as by performing a thorough anterior segment examination and considering systemic causes if indicated, represents a lapse in comprehensive patient assessment. This can lead to delayed diagnosis and treatment of potentially life-threatening conditions, which is ethically unacceptable and falls short of the expected standard of care. Professional reasoning. Professionals facing such a scenario should employ a structured diagnostic decision-making process. This begins with a comprehensive history and physical examination, followed by a systematic ophthalmic evaluation. The priority is always to assess the integrity of the cornea, as this dictates the appropriate use of medications, particularly corticosteroids. Fluorescein staining is a critical, non-invasive tool for this purpose. If the cornea is intact, then treatment can be directed at the conjunctiva and eyelids. If a corneal ulcer is present, the treatment plan must be adjusted accordingly, focusing on ulcer management and avoiding medications that could compromise healing. If initial diagnostics do not yield a clear answer, or if systemic signs are present, further investigations, such as blood work or referral to a specialist, should be considered. This iterative process of assessment, diagnosis, and treatment adjustment, guided by established veterinary principles and ethical considerations, ensures optimal patient outcomes. Question 14. The assessment process reveals a canine patient presenting with progressive vision impairment. Ocular examination identifies significant nuclear sclerosis and early cortical cataracts. The owner is seeking definitive management. Which of the following diagnostic steps is most critical to perform prior to discussing surgical cataract removal to ensure optimal patient selection and surgical planning? Option A. Perform gonioscopy and measure intraocular pressure. Option B. Administer topical anti-inflammatory medications to reduce ocular inflammation. Option C. Obtain a complete blood count and serum biochemistry profile. Option D. Perform electroretinography to assess retinal function. The correct answer is A. Perform gonioscopy and measure intraocular pressure. Explanation. The assessment process reveals a scenario where a veterinary ophthalmologist must navigate the complexities of diagnosing and managing lens disorders in a patient, while adhering strictly to the ethical and professional standards expected of a diplomate of the American College of Veterinary Ophthalmologists, DACVO. This situation is professionally challenging because lens disorders, such as cataracts and lenticular luxations, can have significant impacts on vision and quality of life, requiring accurate diagnosis, appropriate treatment planning, and clear communication with the owner. The DACVO standards emphasize evidence-based medicine, client communication, and professional integrity. The correct approach represents best professional practice because it prioritizes the patient's welfare through a thorough diagnostic workup, including gonioscopy and intraocular pressure measurement, which are crucial for identifying secondary glaucoma associated with lens luxation or certain cataract types. It also involves a comprehensive discussion with the owner about all viable treatment options, including their risks, benefits, and prognoses, aligning with the ethical obligation to provide informed consent and empower the owner to make the best decision for their pet. This approach upholds the DACVO commitment to advanced veterinary ophthalmological care and client education. An incorrect approach that involves proceeding with surgical intervention without a complete diagnostic assessment, such as omitting gonioscopy, fails to identify potential concurrent conditions like glaucoma. This could lead to suboptimal surgical outcomes or even vision loss due to unmanaged intraocular pressure, violating the principle of do no harm and falling short of the diagnostic rigor expected of a DACVO. Another incorrect approach, such as recommending immediate enucleation, without exploring all feasible medical or surgical management options for a potentially treatable condition, demonstrates a lack of due diligence and may not represent the most compassionate or appropriate course of action for the patient and owner, failing to meet the DACVO standards for comprehensive patient care. Furthermore, failing to adequately discuss the risks and benefits of different treatment modalities, or providing a prognosis without a thorough understanding of the underlying pathology, constitutes a failure in client communication and informed consent, which are fundamental ethical requirements. The professional decision-making process for similar situations should involve a systematic approach. First, a complete and thorough diagnostic examination, including all relevant tests for the suspected condition. Second, a comprehensive evaluation of the findings to establish a definitive diagnosis and prognosis. Third, a detailed discussion with the owner, presenting all appropriate treatment options, including their respective risks, benefits, costs, and expected outcomes. And finally, a collaborative decision-making process with the owner, ensuring they are fully informed and comfortable with the chosen course of action, always prioritizing the patient's welfare and adhering to the highest ethical and professional standards. Question 15. The performance metrics show a concerning trend in the accurate differentiation of normal anatomical variations of the canine optic nerve head from early pathological changes. When examining a canine patient with suspected optic nerve dysfunction, which of the following approaches best reflects the rigorous anatomical assessment required for Diplomate level competence? Option A. A detailed, high-magnification examination of the optic disc, meticulously evaluating the optic disc margin, neuroretinal rim, central retinal vessels, and parapapillary region for subtle deviations from typical canine optic nerve anatomy. Option B. Relying primarily on fundic photography to capture the optic disc, assuming that digital images will adequately reveal all subtle anatomical features and potential pathologies. Option C. Prioritizing the assessment of visual function tests over detailed optic nerve head anatomy, assuming that functional deficits will inherently point to anatomical abnormalities. Option D. A rapid visual inspection of the optic disc, focusing on gross abnormalities and comparing the appearance to generalized veterinary ophthalmology textbook illustrations. The correct answer is A. A detailed, high-magnification examination of the optic disc, meticulously evaluating the optic disc margin, neuroretinal rim, central retinal vessels, and parapapillary region for subtle deviations from typical canine optic nerve anatomy. Explanation. The performance metrics show a consistent trend of increased diagnostic errors related to subtle anatomical variations in the canine optic nerve head. This scenario is professionally challenging because accurate identification and interpretation of these variations are critical for differentiating between normal physiological findings and early signs of optic nerve disease, such as optic neuritis or glaucoma. Misinterpretation can lead to delayed or incorrect treatment, potentially causing irreversible vision loss for the patient. The DACVO emphasis on rigorous anatomical knowledge and diagnostic accuracy underscores the importance of this skill. The correct approach involves a systematic, detailed examination of the optic nerve head, utilizing high magnification and appropriate lighting to meticulously assess all anatomical landmarks. This includes evaluating the optic disc margin, the neuroretinal rim, the central retinal vessels, and the presence or absence of parapapillary changes. The correct answer reflects best professional practice by prioritizing a thorough, evidence-based anatomical assessment, which aligns with the DACVO commitment to maintaining the highest standards of veterinary ophthalmology. This approach minimizes subjective interpretation and maximizes the likelihood of accurate diagnosis, directly supporting patient welfare and upholding professional integrity. An incorrect approach that relies solely on a cursory visual inspection without detailed anatomical evaluation fails to meet the diagnostic rigor expected of a DACVO candidate. This represents a failure to adhere to the fundamental principles of ophthalmic examination and diagnostic reasoning, potentially leading to misdiagnoses and patient harm. Ethically, this constitutes a breach of the duty of care owed to the patient. Another incorrect approach that focuses on comparing findings only to readily available, generalized anatomical charts, without considering species-specific or breed-specific variations, overlooks crucial nuances. While general charts are useful, they may not encompass the full spectrum of normal anatomical presentations, leading to misclassification of normal variations as pathological. This demonstrates a lack of depth in anatomical understanding and a failure to apply critical thinking to individual case presentations, which is a cornerstone of advanced veterinary practice. A further incorrect approach that prioritizes speed over accuracy, assuming common presentations are always present, is professionally unacceptable. This haste can lead to overlooking subtle but significant anatomical details that are key to a correct diagnosis. It reflects a disregard for the meticulous nature of ophthalmic diagnostics and a potential compromise of patient care for the sake of efficiency, which is contrary to the ethical obligations of a veterinary specialist. The professional decision-making process for similar situations should involve a commitment to continuous learning and refinement of anatomical knowledge. When faced with ambiguous findings, a veterinarian should consult advanced anatomical atlases, peer-reviewed literature, and potentially seek consultation with colleagues. The process should always prioritize a comprehensive and systematic examination, followed by critical analysis of findings in the context of the individual patient's history and clinical signs, ensuring that diagnostic conclusions are well supported by objective evidence and best practices. Question 16. The risk matrix shows a moderate likelihood of a severe outcome if conjunctivitis in a canine patient is not accurately diagnosed and treated promptly. Given a 3-year-old Labrador retriever presenting with bilateral serous to mucoid discharge, conjunctival hyperemia, chemoses, and mild blepharospasm, which of the following diagnostic and therapeutic approaches best aligns with the DACVO guidelines for managing conjunctivitis? Option A. Perform a thorough ophthalmic examination, including Skirmer tear test, fluorescein staining, and conjunctival cytology, to identify potential infectious or inflammatory causes before initiating targeted therapy. Option B. Advise the owner that conjunctivitis is common and often self-limiting, and suggest supportive care with artificial tears while monitoring for spontaneous resolution. Option C. Initiate empirical treatment with a broad-spectrum topical antibiotic and topical corticosteroid, and reevaluate in 7 days if no improvement is noted. Option D. Prescribe oral antihistamines and recommend environmental modifications to address a presumed allergic etiology without further diagnostic testing. The correct answer is C. Initiate empirical treatment with a broad-spectrum topical antibiotic and topical corticosteroid, and reevaluate in 7 days if no improvement is noted. Explanation: this scenario is professionally challenging because it requires the veterinarian to differentiate between various causes of conjunctivitis, each with distinct etiologies, diagnostic pathways, and treatment protocols. Misdiagnosis can lead to delayed or inappropriate treatment, potentially causing chronic discomfort, vision impairment, or even vision loss for the animal, impacting the human-animal bond and client satisfaction. Furthermore, the veterinarian must adhere to established veterinary ophthalmology standards of care, as outlined by the DACVO, ensuring that diagnostic and therapeutic decisions are evidence-based and ethically sound. The correct approach represents best professional practice because it systematically addresses the differential diagnosis for conjunctivitis based on clinical presentation, patient history, and diagnostic findings. This aligns with the DACVO emphasis on thoroughness, evidence-based medicine, and patient welfare. By considering infectious, allergic, immune-mediated, and irritant causes, and employing appropriate diagnostic tests such as cytology, viral testing, or allergy testing, the veterinarian can arrive at an accurate diagnosis. Subsequent treatment, tailored to the specific etiology, maximizes the chances of a positive outcome and minimizes the risk of complications. This methodical approach is consistent with the ethical obligations of veterinary professionals to provide competent and compassionate care. An incorrect approach that relies solely on empirical treatment without a definitive diagnosis is professionally unacceptable. This failure constitutes a breach of the standard of care, as it bypasses crucial diagnostic steps that are essential for identifying the underlying cause of the conjunctivitis. Such an approach risks masking symptoms without addressing the root problem, potentially leading to treatment resistance, chronic disease, or the development of secondary complications. Ethically, this represents a failure to act in the best interest of the animal patient, as it prioritizes expediency over accurate diagnosis and effective treatment. Another incorrect approach would be to dismiss a potentially serious underlying cause, such as a viral infection or an immune-mediated condition, in favor of a simpler explanation like a mild irritant. This oversight can lead to significant delays in appropriate treatment for conditions that require specific antiviral therapy or immunosuppressive medications. The failure to consider and rule out serious etiologies demonstrates a lack of due diligence and can result in irreversible damage to ocular tissues. The professional decision-making process for similar situations should involve a structured approach. 1. Thorough history. Gather detailed information about the onset, duration, progression, and any concurrent symptoms. 2. Comprehensive ophthalmic examination. Perform a complete ocular exam, including visual acuity, menace response, pupillary light reflexes, palpation of orbital structures, and detailed examination of the eyelids, conjunctiva, cornea, anterior chamber, iris, lens, and fundus. 3. Differential diagnosis generation. Based on the history and initial exam, create a list of potential causes of conjunctivitis. 4. Targeted diagnostics. Select appropriate diagnostic tests, e.g., Skirmer tear test, fluorescein stain, cytology, viral swabs, allergy testing, intraocular pressure measurement, to confirm or rule out differentials. 5. Diagnosis and treatment planning. Formulate a definitive diagnosis and develop a treatment plan that is specific to the identified etiology, considering patient factors and owner compliance. 6. Monitoring and reevaluation. Schedule follow-up appointments to assess treatment efficacy, monitor for adverse effects, and adjust the plan as needed. Question 17. The audit findings indicate a recent case where a canine patient presented with bilateral lens opacities. The referring veterinarian's notes suggest a presumptive diagnosis of age-related nuclear sclerosis, but the owner reports a noticeable decline in the dog's visual acuity over the past 6 months. Considering the potential for true cataracts and the need for optimal patient management, what is the most appropriate next step in evaluating and addressing this patient's condition? Option A. Recommend topical anti-inflammatory eye drops to manage any perceived discomfort associated with the lens opacities, deferring surgical considerations until vision loss is complete. Option B. Proceed directly to surgical consultation for phacoemulsification, assuming the opacities are significant enough to warrant intervention. Without a comprehensive preoperative workup, Option C. Perform a complete ophthalmic examination including visual acuity assessment, gonioscopy, fundic examination, and intraocular pressure measurement, followed by a detailed discussion with the owner about the findings, potential surgical interventions like phacoemulsification or extracapsular lens extraction, and the importance of preoperative systemic health screening. Option D. Advise the owner that the opacities are likely benign nuclear sclerosis and no further diagnostic or therapeutic intervention is necessary, as it is a common age-related change. Correct answer is C. Perform a complete ophthalmic examination including visual acuity assessment, gonioscopy, fundic examination, and intraocular pressure measurement, followed by a detailed discussion with the owner about the findings, potential surgical interventions like phacoemulsification or extracapsular lens extraction, and the importance of preoperative systemic health screening. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary ophthalmology where a diagnostic finding, lens opacity, requires a nuanced interpretation and a tailored treatment plan. The challenge lies in differentiating between various types of cataracts, understanding their underlying etiologies, and selecting the most appropriate surgical intervention based on the patient's overall health, the cataract's characteristics, and the owner's expectations, all within the framework of established veterinary ethical and professional standards. Correct approach analysis. The correct approach involves a comprehensive diagnostic workup to characterize the cataract and assess the patient's suitability for surgery. This includes a thorough ophthalmic examination, potentially advanced imaging, and systemic health evaluation. Surgical planning should then be based on the specific cataract type, e.g., nuclear sclerosis vs. true cataract, cortical vs. nuclear anterior vs. posterior subcapsular, its maturity, and the presence of any concurrent ocular pathologies. The decision to proceed with phacoemulsification or extracapsular lens extraction, along with the choice of intraocular lens implantation or other management strategies, must be evidence-based and prioritize the patient's welfare and the likelihood of a successful outcome. This aligns with the DACVO commitment to advancing veterinary ophthalmology through rigorous scientific inquiry and the application of best practices, ensuring that treatment decisions are not only technically sound, but also ethically justifiable and in the best interest of the animal. Incorrect approach is analysis. One incorrect approach would be to recommend immediate surgical intervention without a thorough diagnostic evaluation. This fails to identify the specific type of lens opacity, its impact on vision, or potential contraindications for surgery, violating the principle of informed consent and potentially leading to suboptimal outcomes or unnecessary procedures. Ethically, this bypasses the due diligence required to ensure the patient is a good surgical candidate and that the chosen procedure is the most appropriate. Another incorrect approach would be to dismiss the opacity as age-related nuclear sclerosis without further investigation, especially if it significantly impairs vision. While nuclear sclerosis is common, it can coexist with or be mistaken for true cataracts, and failing to differentiate could lead to misdiagnoses and delayed or inappropriate treatment. This demonstrates a lack of thoroughness and adherence to diagnostic best practices. A third incorrect approach would be to offer a surgical solution that is not supported by current evidence-based veterinary ophthalmology, or that carries an unacceptably high risk of complications for the specific cataract type and patient. This could involve using outdated techniques or failing to consider the nuances of modern cataract surgery, such as the importance of intraocular lens power calculation and placement. This approach neglects the professional obligation to provide care that meets the highest standards of the specialty. Professional reasoning. Professionals should approach such cases by first establishing a definitive diagnosis through a systematic and comprehensive ophthalmic examination. This includes assessing visual function, intraocular pressure, fundic examination, and if necessary, advanced diagnostics like ocular ultrasound or electroretinography. Following diagnosis, a thorough discussion with the owner regarding the nature of the cataract, prognosis with and without surgery, surgical options, potential risks and benefits, and expected outcomes is crucial. The decision-making process should be guided by the patient's best interests, owner's capacity to provide post-operative care, and the veterinarian's expertise and available resources, always adhering to the ethical principles of veterinary medicine and the standards of the DACVO. Question 18. Assessment of intraocular pressure in a canine patient presents a diagnostic challenge when significant corneal edema is present. Considering the potential for artifactual readings, which of the following approaches best reflects current veterinary ophthalmology standards for accurate IOP assessment in this specific clinical scenario? Option A. Immediately initiate glaucoma therapy based on the first elevated reading obtained from a handheld electronic tonometer without further verification. Option B. Obtain multiple readings using a single applanation tonometer and average them, assuming the edema will not significantly skew the results. Option C. Proceed with a single measurement using a rebound tonometer, as this method is generally less affected by corneal thickness variations than other tonometers. Option D. Disregard all tonometry readings due to the corneal edema and rely solely on fundic examination for signs of optic nerve damage. The correct answer is C. Proceed with a single measurement using a rebound tonometer, as this method is generally less affected by corneal thickness variations than other tonometers. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in veterinary ophthalmology, accurately assessing intraocular pressure, IOP, in a patient with potential corneal pathology. The presence of corneal edema, common sequela to various ocular diseases or trauma, directly impacts the readings obtained from tonometry. This necessitates a nuanced understanding of how different tonometric methods are affected by corneal thickness and integrity, and the clinical significance of these variations in guiding diagnosis and treatment. Failure to account for these factors can lead to misdiagnosis of glaucoma or other pressure-related disorders, potentially resulting in irreversible vision loss. Correct approach analysis. The correct approach involves recognizing the limitations of standard tonometry in the presence of corneal edema and selecting a method that is less susceptible to these artifacts or employing appropriate adjustments. In the U.S. regulatory framework, best professional practice is guided by established veterinary ophthalmology principles and the ethical obligation to provide competent care. American College of Veterinary Ophthalmologists, DACVO, emphasizes evidence-based medicine and the judicious application of diagnostic tools. Therefore, utilizing a tonometric method that is known to be more reliable in edematous corneas, such as rebound tonometry, e.g., tonovet, or applanation tonometry with careful consideration of corneal hydration and thickness, and potentially correlating findings with other diagnostic signs of glaucoma, e.g., optic nerve head changes, visual field deficits if applicable, represents best professional practice. This approach prioritizes patient welfare by seeking the most accurate diagnostic information despite confounding factors, aligning with the ethical duty of care and the pursuit of diagnostic excellence. Incorrect approaches analysis. One incorrect approach would be to solely rely on a single tonometric measurement obtained with a method highly susceptible to corneal edema, such as a standard tono pen, without considering the corneal status, or attempting to verify the reading with an alternative method. This fails to meet the standard of care by not accounting for known sources of error, potentially leading to a false diagnosis of glaucoma or a false sense of security if the edema is masking elevated IOP. Ethically, this constitutes a failure to exercise due diligence and competence. Another incorrect approach would be to dismiss the IOP measurement entirely due to the corneal edema without attempting any form of tonometry or considering alternative diagnostic indicators. This abandons a crucial diagnostic step without justification and could lead to a misdiagnosis of a serious condition like glaucoma, violating the duty to diagnose and treat. A third incorrect approach would be to proceed with aggressive glaucoma treatment based solely on an unverified, potentially artifactual IOP reading from an edematous cornea, without further investigation or confirmation. This is not only potentially harmful to the patient due to unnecessary medication side effects, but also represents a failure to adhere to a systematic diagnostic process, which is a cornerstone of responsible veterinary practice. Professional reasoning. Veterinary ophthalmologists must adopt a systematic approach when assessing IOP, especially in the presence of corneal pathology. This involves 1. Initial assessment of corneal integrity and hydration. 2. Selection of the most appropriate tonometric method based on the corneal status and available equipment. 3. Critical evaluation of the obtained readings, considering potential artifacts. 4. Correlation of IOP measurements with other clinical signs and diagnostic findings. 5. If uncertainty persists, employing alternative methods or seeking further diagnostic information. This decision-making framework ensures that diagnostic conclusions are based on the most reliable data, prioritizing patient well-being and adhering to professional standards. Question 19. Comparative studies suggest that while genetic testing is increasingly available for inherited retinal diseases in canines, its application in routine clinical practice for prognostication can be complex. A veterinarian diagnoses progressive retinal atrophy, PRA, in a Cavalier King Charles Spaniel based on characteristic fundic changes and electroretinography. The owner inquires about the long-term prognosis and the likelihood of blindness. Given the breed's predisposition to specific forms of PRA, what is the most ethically and professionally sound approach to advising the owner regarding the prognosis? Option A. Recommend an experimental treatment protocol that has shown anecdotal success in a small number of cases, without disclosing the lack of robust scientific evidence or potential risks. Option B. Provide a prognosis based on the typical progression rate of PRA in Cavalier King Charles Spaniels, acknowledging that individual variability exists and that genetic testing, if available and performed, could offer further insight into the specific genetic mutation and its known impact on progression. Option C. Advise the owner that the condition is untreatable and that no further diagnostic steps or management strategies are necessary, as the outcome is predetermined. Option D. State definitively that the dog will become blind within 2 years, as this is the average age of onset for PRA in this breed, and recommend immediate euthanasia to prevent suffering. The correct answer is B. Provide a prognosis based on the typical progression rate of PRA in Cavalier King Charles Spaniels, acknowledging that individual variability exists and that genetic testing, if available and performed, could offer further insight into the specific genetic mutation and its known impact on progression. Explanation. This scenario presents a professional challenge due to the inherent uncertainty in diagnosing and managing inherited retinal diseases in veterinary ophthalmology. The veterinarian must balance the desire to provide the best possible care for the patient with the ethical and regulatory obligations to avoid misrepresentation and to ensure informed consent. The complexity arises from the genetic basis of many retinal diseases, the potential for variable expressivity and incomplete penetrance, and the limited availability of definitive genetic testing for all breeds and conditions. Careful judgment is required to interpret clinical findings, communicate prognostic information accurately, and guide owners through treatment and management decisions, especially when definitive genetic prognostication is not possible. The correct approach represents best professional practice because it prioritizes accurate diagnosis, transparent communication, and client education, all of which are fundamental to ethical veterinary practice and align with the principles of responsible animal care. This approach emphasizes the veterinarian's duty to provide honest and evidence-based information, enabling owners to make informed decisions about their pet's health and welfare. It also reflects a commitment to professional integrity by acknowledging the limitations of current diagnostic capabilities and avoiding speculative prognoses. An incorrect approach that involves making definitive prognoses without sufficient evidence or genetic confirmation would be a regulatory and ethical failure. This could constitute misrepresentation of the animal's condition and prognosis, potentially leading to inappropriate treatment decisions or financial burdens for the owner. Furthermore, failing to disclose the uncertainties associated with inherited retinal diseases and the limitations of diagnostic tools would violate the principle of informed consent, a cornerstone of veterinary client-patient relationships. Another incorrect approach, such as recommending aggressive, unproven treatments based on anecdotal evidence rather than scientific literature, would also be ethically problematic and potentially harmful, violating the veterinarian's duty to provide care that is in the animal's best interest and supported by sound scientific principles. The professional reasoning process for similar situations should involve a thorough clinical examination, a comprehensive review of the available literature for the specific breed and suspected condition, and a candid discussion with the owner about diagnostic limitations and prognostic uncertainties. The veterinarian should clearly articulate what is known, what is suspected, and what remains unknown. When genetic testing is available and appropriate, it should be discussed as a diagnostic and prognostic tool, along with its limitations and interpretation. The focus should always be on providing the most accurate information possible, managing owner expectations realistically, and developing a treatment or management plan that is tailored to the individual patient and owner's circumstances, prioritizing the animal's welfare. Question 20. Quality control measures reveal that a veterinary ophthalmic lens, intended for precise light transmission and refraction during a diagnostic procedure, exhibits subtle but consistent deviations from its specified optical parameters. The veterinarian notes that images viewed through the lens appear slightly distorted, and the perceived intensity of light passing through it seems altered. What is the most appropriate risk assessment approach to address this situation? Option A. Document the observed deviations, compare them against the manufacturer's technical specifications and performance data, and consult peer-reviewed literature on optical principles relevant to the device's function. Option B. Assume the observed deviations are within acceptable tolerances for routine veterinary use and proceed with the diagnostic procedure as planned. Option C. Immediately contact the manufacturer to report a suspected manufacturing defect and request a replacement without further internal investigation. Option D. Attempt to adjust the lens's focal length or aperture settings to compensate for the perceived distortion and altered light intensity. The correct answer is C. Immediately contact the manufacturer to report a suspected manufacturing defect and request a replacement without further internal investigation. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the veterinarian to assess a potential deviation from expected optical performance in a veterinary ophthalmic device. The challenge lies in determining the root cause of the observed light transmission and refraction anomalies, which could stem from manufacturing defects, improper handling, or inherent limitations of the device. A thorough risk assessment is crucial to ensure patient safety and the efficacy of the diagnostic or therapeutic intervention. The DACVO framework emphasizes evidence-based practice and adherence to standards that protect animal welfare. Correct approach analysis. The correct approach involves a systematic evaluation of the device's optical properties against established specifications and manufacturer guidelines. This includes verifying the device's calibration, assessing for physical damage that could alter light transmission or refraction, and consulting relevant literature or expert opinion if the observed anomalies are subtle or unusual. This aligns with the DACVO commitment to maintaining high standards of veterinary ophthalmology, ensuring that diagnostic tools and therapeutic devices function as intended, thereby minimizing risks to patients and ensuring accurate clinical decision-making. Adherence to manufacturer specifications and established optical principles is paramount. Incorrect approaches analysis. One incorrect approach would be to dismiss the observed anomalies without further investigation, assuming they are insignificant or within an acceptable tolerance without verification. This fails to uphold the DACVO standard of due diligence and could lead to misdiagnosis or ineffective treatment due to inaccurate optical data. Ethically, this represents a failure to act in the best interest of the animal patient. Another incorrect approach would be to immediately attribute the issue to a specific cause, such as a manufacturing defect, without a comprehensive assessment. This premature conclusion bypasses the necessary steps of risk assessment and could lead to unnecessary product returns or complaints, or conversely, overlooking a correctable issue. It demonstrates a lack of systematic problem solving, which is a cornerstone of professional practice. A third incorrect approach would be to attempt to recalibrate or modify the device without proper training, documentation, or understanding of its optical principles. This could further compromise the device's functionality, potentially leading to inaccurate readings and subsequent harm to the patient. It violates the principle of practicing within one's scope of expertise and adhering to manufacturer guidelines. Professional reasoning. When faced with unexpected optical performance in a veterinary ophthalmic device, a professional veterinarian should initiate a risk assessment process. This begins with a thorough review of the device's specifications and intended use. Next, a systematic evaluation of the device's physical condition and functional parameters should be conducted. This may involve comparing its performance to known standards or a control device. If anomalies persist, consulting manufacturer support or relevant scientific literature is indicated. The ultimate goal is to ensure the device is functioning optimally to provide accurate diagnostic information or therapeutic effect, thereby safeguarding animal welfare and maintaining professional integrity.